Let's talk about ethics in holistic health because making the right decision isn't always black and white. In fact, according to a national health interview survey, 72% of patients want their doctors to discuss alternative and holistic health options, but most do. If you're new to my channel, welcome. My name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school, so you don't have to. This week, we have tons of amazing programming, including our morning flow class, which jumps back off Tuesday at 6 a.m. It's all week long, Monday through Friday, typically 6 a.m. And replays are available in the playlist if I don't go live that day or if you want to check it out at a different time. This week, I'll also be on 100 Packs Live, Wednesday, 12 p.m. Eastern Standard Time, talking all things holistic medicine with an awesome panel. So definitely check us out. Thursday, my weekly Lunch and Learn is on stress management this week. So check it out. If you're not able to make it because you're working or whatever, go ahead and click the link below and you can go ahead and register. This video is a class part of my Intro to Holistic Medicine course. Still time to register, self-paced. We do record it live Wednesdays at 7 p.m. as well as Saturdays 11 a.m. So click the link in the bio to register if you're interested. So back to the study. So 72% of patients want their doctors to discuss alternative and holistic options, but most never do. So a few things with that. So we must understand that conventional doctors are not in holistic practices. We also must understand that they have typically a superiority bias or a confirmation bias. So a lot of times patients realize that even when they talk to their doctor, they're going to be shut down, which is actually against informed consent and patient autonomy. And so in holistic health, we have to balance informed consent. We educate our patients on all of the options without pressure and coercion, meaning that I am legally, right, and ethically obligated to provide all options, meaning I provide natural as well as not natural options. And as an integrative health provider, I often work with conventionally trained doctors when the patients need disease management. So if a patient needs disease management, right, they have a disease, there needs to be a conventional doctor on duty on that patient's care team to make sure that that disease does not get out of control, right? With that being said, patients do have the right to seek alternative solutions for their disease condition, even if our job is to treat causes and not to manage diseases, because that's not really our job, is to manage a disease, because a disease is nothing more than a sophisticated labeling system. It doesn't really indicate how what actually caused the problem. So I like to say that conventional doctors are often the firefighters of medicine. They go and run and put the fires out. We're more like the medical detectives. We come back after the fact and understand why the fire started to begin with. So think Columbo, think House, think all of those things, where you're going through all of these clues and deductive reasoning. That's really what we do in holistic medicine. Whereas in conventional medicine, it's more short lever, it's more reactive, it's more acute care, stabilize the patient and keep them moving. And they wait until something becomes a problem before, it happens. So oftentimes we as holistic providers will see patients either once they've exhausted the healthcare system and there is no disease process and they're still not getting relief because it's subclinical, or, they take a more proactive stance and they come to me initially, and then, I serve the role to really help them and their family with their care. Or they're rejecting the conventional recommendations and want to seek an alternative health solution, right? And so we always respect a patient's autonomy. We respect their right to choose. So I have patients, patients assume that I'm, anti-vax or anti-anything. And in fact, I'm not. I'm pro-science. I'm pro-informed consent. I'm pro-patient autonomy, and I'm pro-responsibility. So knowing, what all of the different risk factors that may be present for any condition, because there are certain, in conventional medicine, there's side effects, right? In natural medicine, we have, the healing crises, and we have, different things like that, which you need to be able to be skilled and trained to work with that rhythm of the body. Otherwise, you'll do more harm, unfortunately. Other thing I want to mention is conventional doctors, unless they go through formal training in holistic medicine, they are not holistic providers. And I know that can be really confusing for people, and they want to, use their insurance, and leverage that. Conventional doctors are part of the American Medical Association. They are adamantly opposed, not staunchly. It's kind of, they begrudgingly let us in a little bit, but fundamentally, when Rockefeller first started and he sent Flexner out, it was no go on the natural medicine. It was only synthetic. So that is the training. That's the education. So there is no, it's all hogwash. We're a whole bunch of hippies and quacks. We've been that way for a while. It's only in the last several years that naturally foiled again, it's not working. Patients are not getting better. And so they're rejecting, the conventional system, as they always have. This is not a new occurrence. It kind of, people reject it, they run back. It's like an abusive partner, sadly. People cannot let go of the healthcare system and almost sometimes refuse to not participate in it, even if it's not working, even if it's more harmful to them, even if it's more abusive. And so that's why I really am an advocate, and we need more holistic healthcare practitioners, who are highly trained, who are science-based, so we can catch these things before they become problems. We can teach our patients what to do proactively. So we're only using the healthcare system for catastrophic events or acute conditions, or some of our testing that we need to do, like your colonoscopy and things like that, to be able to assess the health and monitor the body. So absolutely, just want to reiterate, there's no one size fit all answer, right? But we want to, as ethical holistic health practitioners, we want to prioritize transparency, education, respect, and we want to make sure we really represent this profession in the most professional light. I definitely have taken lots of heat, for people in this, profession who lack the training, who lack the education, who lack the experience, who are just in it for money. I call all of that out, because that is not true holistic medicine. Right now, more than ever, we need more Black and Afro Indigenous people within holistic medicine, simply because holistic medicine, with the advent of RFK, is now being kind of whitewashed. Not kind of, it is. I've seen people pop up, that I've never seen in the holistic health field, and now all of a sudden they're the wise, guru sage, while the rest of us, who are carriers of the medicine and have been working with it for a long, long time, we get pushed aside and not seen and not heard. And, however, we are the creators and the originators of this practice. So as you will find, as you go on this journey with me and learn more, about holistic medicine and the actual practice of it, you'll really begin to understand the depth and the complexity of it and the nuance of it. And this isn't like a, 3 steps to this or a 5 steps to that. This is a lifestyle. This is a lifetime of healing, unpacking, and really just reclaiming your health, not just from a physical perspective, but truly from a mental, emotional, psychosocial, and spiritual perspective. So thank you so much for attending. We've got one more video for this week, which will talk about the stages of change. And I look forward to seeing you all this week. Again, if you are interested in registering for the self-paced Integrative Holistic Medicine class, all you have to do is click the link in the bio, fill out the form, and join us.